In this first of a two-part series, I wanted to share with you some of the things that you need to watch out for in terms of complications that you could experience while at home. The bottom line is to pay attention to your body. If you're feeling something that's very unusual, very uncomfortable, making you feel sick or short of breath, then your doctor definitely needs to know about it, or you need to seek immediate care. Expect it or not, nobody likes surprises, and that's why I'm sharing this with you in this two-part module. So some common events that you're going to experience is what's called atelectasis, where the lungs settle on themselves. This is due, number one, to surgery, number two, to lying in bed, number three, to not breathing deeply because your chest just hurts, no doubt, and it can set you up to have some difficulties breathing and pneumonia. So that's why it's critical that you're using your incentive spirometer and coughing as instructed. Effusion, that's just a collection of fluid, and I'll show you a picture of that in a minute, but that's common also with cardiac surgery or any chest surgery where some fluid develops around the lung, and depending on how big it is, that's going to have an impact whether or not you have any symptoms. Mild to moderate, maybe no symptoms. Major fluid accumulation most likely is going to cause some shortness of breath and difficulty with activity. Superficial thrombophlebitis, obviously during open heart surgery, you have a variety of catheters in place and IVs, and during your hospitalization, probably some rotation of IV sites. Understand that anytime you poke into a blood vessel and put something foreign in there, like a small catheter, it creates some inflammation. That's just a normal part of the bodily process. And on occasion, it becomes inflamed, the vein becomes inflamed, and can form sometimes even just a little bit of a clot there. It's not the worrisome deep vein clot in the legs that can pass through the heart, cause pulmonary embolism, stroke, and other things, but just an irritation more often in the arm or hand or wrist, and I'll show you a picture of that in a moment. Irregular heartbeat and palpitations, this is certainly common with any heart patient in general. If it's sustained or rapid or is making you feel poorly, that's something different. That needs attention. So on the left here you can see there's a little bit of redness on the back of my hand, at the top of the picture extending towards the bump in my wrist. There was an IV there. It was a difficult spot because my wrist was bent a lot, created some irritation, and it was fairly simple to treat. I was already on an aspirin. I used a heating pad for a couple days and it went away. Atrial fibrillation, unfortunately, occurs in about 1 out of 3 or maybe even 2 out of 3 patients who have undergone heart or valve surgery or any open chest procedure. And I know you don't look at EKGs for a living, but as you can see, the little fluctuations from the baseline are not uniformly spaced. This is my tracing atrial fibrillation that I had at a heart rate of 92. And then moving on to the far right is an x-ray of mine during my hospitalization. You can see on the left side of the picture, if you look towards the darker space in the ribs, you'll see a whiter shadow that looks somewhat like a V, and then below that a more whiter shadow. That is an effusion. Just compare the two sides of the chest, the left side and the right side, and it's completely different. Serious events can and do occur. The point is not to tough it out at home. There's no medal for bravery or bravado, and I encourage you to seek care promptly. Some of the serious events would include infections like infectious endocarditis, which is very rare, fortunately, but pneumonia, which is not. And so if you're having cough, fever, shortness of breath, get your butt into the emergency department or your doctor and get some prompt care before things get out of hand. Atrial fibrillation I alluded to a bit ago, and I'll cover more in detail here next. Medication reactions or interactions certainly can and do occur. Many of us are on a number of medications in the immediate post-operative phase, maybe some chronic medications even prior to surgery, and some new medications after surgery. And unfortunately, these can interact with each other, cause side effects. And so if you're in doubt, certainly take the time, make a call, get the answers you need, talk to your pharmacist, and make sure nothing more serious is occurring. So atrial fibrillation, as I alluded to, is common. 1 in 3, maybe even up to 2 in 3 open heart surgery patients have this. It's absolutely the most common arrhythmia, which just means irregular heartbeat, after surgery. Fortunately, most of the data shows that this goes away within 1 month, maybe 4 to 6 weeks as a general ballpark. And what happens is the top part of the heart is just quivering. It's not pumping, not filling the bottom part of the heart, and it doesn't pump overall very well. Common symptoms include fatigue, palpitations, shortness of breath, lightheadedness, just depending on how fast the atria are pumping and how fast the bottom part of the heart, the ventricles, are trying to keep up. Unfortunately, some people can't feel this at all or don't have any symptoms, which puts them at a higher risk for stroke. Bottom line therapy for this is often medications that may be started in the hospital or may be given at discharge depending on when and how often atrial fibrillation occurs. There are two schools of thought. One is to try to get rid of it, to make it go away, which is rhythm control. And then the second is rate control. For people with very fast atrial fibrillation, it's generally not tolerated if the heartbeat is over 120 to 150 beats a minute. Many people are short of breath. They feel sick, lightheaded, maybe nauseous. And in that setting, the goal more often is to get it back into a slower rate and then possibly try to convert it into a normal sinus rhythm, which is the normal beat-to-beat variation that is just the normal baseline. Unfortunately, it's a major risk for blood clots and stroke. When the atria pumps so fast, the blood pools in the atrium and doesn't get pumped out like it's supposed to. Clots can form, and when they do, they have the potential to break off and shoot throughout your body, so potentially to the lungs, the brain, arms, kidneys, other organs, other areas. So, take-home point here. If you have chest pain when you're breathing, if you're coughing up blood, you're feverish, you're short of breath, you're clammy, that is a sign that you need immediate attention. Call 911, get help immediately, get to the emergency department. At times, the medications don't work for atrial fibrillation, or the rate is very fast and the symptoms aren't tolerated. Obviously, that's me in the upper right there. And unfortunately, I had several episodes of atrial fibrillation that were not controlled with medication and not very well tolerated, and I underwent what's called cardioversion. They put you to sleep, you're sedated, you're comfortable, you're asleep, and they use a synchronized charge to shock and reset the heart. I understand that not all of you want to see this, but if you're curious about what cardioversion and sedation is all about, there is a video at the end of this course in the extra section. Stroke, hopefully you're aware of signs and symptoms of stroke, and this includes sudden weakness, numbness, loss of strength, dizziness, inability to walk, inability to coordinate balance, sudden severe headache, or loss of vision. These are all emergent signs, and time is critical. Call 911 and get to the emergency department as fast as possible. Be sure to watch part 2 of what to watch for. I explain some other complications in detail, and you will want to know about those. Don't miss it.